I'm Jeremy Steinberger. Today we're going to be looking at new augmented reality goggles. These have tremendous future applications in spine surgery. So patients come into your office, they're often very overwhelmed by what you're telling them. You can use a spine model, you can show them their pathology on a model, but it's never the same as having their own MRI, their own CAT scan fused together in a virtual model for them to really look at everything and understand. So without further ado, this is how we put on the augmented reality goggles. As you can see, I'm taking a little tour of his spine, walking around from front to back. You see blue is spinal cord. You see a beautiful picture of the bony landmarks coming around the front. You see the way we actually look at it during surgery. And if you walk toward it, you can really see exactly how we see the front of the spine in surgery. On the side, you see the carotid arteries, you see the vertebral arteries, you see the bones rendered beautifully from the CAT scan, and you see his skull, rib cage, shoulder blades, hyoid bone, everything that's possibly relevant to the surgery. We can rotate this around, we can zoom in, we can zoom out, we can move it side to side, and now you can see I'm looking at the spine from the back. And I can come all the way in. I can even pull a spinal vertebral body away and move it around in space. I can take the other spinous process and lamina away, and I can look at this patient's herniated disc pushing on their spinal cord. Do we come from the front of the spine? Do we come from the back of the spine? That's called the anterior versus the posterior approach. Are there any abnormal loops of artery that come close to our approach that are at risk during the procedure? How is the bone quality? Where do the arteries lie? Where does the herniated disc go? Where is the herniated disc pushing on the spinal cord? And you can see here that we have a beautiful view of a yellow herniated disc pushing on the spinal cord. This technology is incredible. Patients love it, surgeons love it. And the more we use it, the more applications we are finding for it. And this is incredibly useful for surgeons as they can practice and plan based on patient-specific anatomy to tailor-make an approach that's specific for that patient. It's also helpful to explain to patients their pathology, explain to them why the risks of surgery are the risks, what the benefits are, how we're going to do it, and do a very thorough review with the patient. The patient will often leave the office with an enhanced understanding of what we're doing and their pathology. Well, that was awesome. I just used augmented reality program to look at my patient's specific anatomy, fusing his CAT scan and his MRI together, looking at this beautiful model and analyzing what approach we should take, explaining it to the patient in detail, who now walks away with a much more thorough understanding of his specific pathology and what we're planning on doing.